Alright, 30-second video coming up. Alright, so we arrived on scene here. We're just making sure that the scene is safe. Any dangers that could potentially harm myself or my partner, who is currently not evident. Safety precautions, so standard PPE, I'm going to use gloves. I don't feel that glasses are necessary at the moment, so I'm going to stick with gloves. I'm also going to introduce myself to the patient and explain to them that I'm going to conduct a neurological assessment and explain to them what entails in that. So, hello there, my name's Reese, I'm from the ambulance service. What's your name?
Aisha.
Aisha, nice to meet you, Aisha. I'm going to conduct a neurological assessment on you today. It's going to involve shining a light in your eye, getting you to conduct a few movements for me and repeat a few sentences. Are you okay with that?
I'm okay with that.
Great. So I gain consent, explain the procedure to the patient, so now I'm going to conduct a neurological assessment. It's just going to begin with going over AVPU. So the patient is currently alert. They would be only responding to verbal stimuli, P, painful stimuli, or U, unresponsive. I'll now conduct a FAST assessment, which is face, arms, speech, and time to act fast. So I'm looking at Aisha's face now, seeing whether I can notice bilateral evenness or unilateral drooping around her eyes, around her mouth, or anything like that. I'll also get the patient to smile at me. Can I have a big smile, please, Aisha? Great, beautiful smile now. So I'm also looking here to make sure that her smile does rise equally. Arms. So Aisha, now could you just pop both your arms out straight in front of me? Great. Just make sure there's no unilateral drooping or weakness in either side. It's bilaterally equal and strong. Aisha, now if you could just grab my hands and give me a big squeeze. Great, happy with that. Again, looking for bilateral evenness in the strength. Either one side, stronger or weak than the other, would be raise some concerns. S in faster speech. So Aisha, I'm going to get you to repeat a sentence for me today. Is that okay with you?
That's fine.
Great, no worries. My light shines red, especially when Batman's around.
My light shines red, especially when Batman's around.
Alright, great. So now what I'm looking for here to make sure that her speech is coherent, there's no slurring of words or even dysphagia, so whether she's drooling from one side of the mouth or anything like that. And I think she passed that exam. Any negatives in that result would fall upon T, which is time to act fast, but I'm happy with the positive reading for those 3 exams. I'll also gain a BGL as well, because hypertension also signifies very similar to symptoms and signs to stroke. It's definitely a differential diagnosis, so I'll gain a BGL with a BGL monitor, drawing a finger prick, draw of blood, and seeing whether it falls in the regular ranges of 4 to 8 millimoles. So anything subseding that would dignify hypertensive, which could then provide symptoms and signs of stroke, leading to hypertension. I'm also going to get a GCS score here now, which is a mnemonic I like to use, EVM, so eyes, verbal, motor. Eyes is a score of 4, so 1 is not responsive, 2 with responds to pain, 3 responds to verbal stimuli, and 4 responds appropriately. V is non-responsive, is a score of 1, 2 is incomprehensible sounds, 3 is inappropriate words, 4 is sentences that are confused and don't really make sense, and 5 is coherent, talking about Batman and the light. M is a score of 6, so 1 is completely unresponsive, 2 is extends to extension, 3 is flexion, 4 is flexion due to pain, 5 is localised to pain, so if she has a sore shoulder and I touch the shoulder, she withdraws from that. And 6 is able to follow commands. So I'm just going to get her to follow a command of mine. If you could please just lift up your left arm for me now, Aisha. Okay, great. And your right arm. Great. Now if you could put both hands above your head for me like this. Great. So she was able to follow those commands. So she has a current GCS score of 15, which we're very happy about. Now Aisha, I'm going to shine a light in your eye. Is that okay with you?
Yeah, that's fine.
Great. So when I shine the pupil light in the patient's eye, I'm going to go lateral to medial. I'm going to go over each eye twice, so very equal and reactive. Great, so what I'm looking for while shining the light in the patient's eye is to see the size of the patient's pupils, which currently we've got 2 millimeters and pearl. And also to see whether the patient's pupils are dilating and constricting appropriately to the shining of the light, and also the speed and rate of which that patient's eye pupils do constrict, whether they're slow, sluggish, brisk, fast, and bilaterally equal. It's very important. After I've gained all these readings and gained all this insight to the patient's symptoms and signs, I'm going to explain that to the patient and also make a decision for transport. So Aisha, now after conducting this neurological assessment, I'm quite happy with everything that's come back positive, so I'm very happy with how you are. How are you feeling right now?
I'm feeling alright, yeah.
That's good. So there's no need to transport this patient. She's going to stay here in the comfortable lounge, and thank you very much.
Nice to meet you.
You too.